Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Thamina Mubarak. In this presentation, I will review two research articles on training and development in healthcare. The first article evaluates e-learning programs for healthcare professionals, while the second examines the effectiveness of management training programs. I will also share two HR tools that can support training and development in practice. First article is a systematic review by Airy and colleagues in 2024. It explores the effectiveness of e-learning programs for capacity building in healthcare. The authors highlight that healthcare professionals face rapid changes in technology and patient care, which require continuous professional development. Previous study already shown that training improves service quality, but this review investigates how digital learning formats such as synchronous, asynchronous, and blended modules affect learning outcomes. Move to methodology. This was a systematic review of 41 studies conducted in various healthcare settings, including hospitals and universities. The review examined different e-learning interventions such as live online session, self-paced modules, blended learning, and independent digital learning. The outcomes assessed including knowledge acquisition, skills improvement, and user satisfaction. Discussion and conclusion for Article 1. The review found among evidence that e-learning improves both knowledge and skills among healthcare professionals. Blended learning approaches where digital modules are combined with face-to-face practice were the most effective. However, common barriers included internet access, learning motivation, and technical challenges. The author recommended designing programs that mix digital flexibility with practical hands-on training. The second article is by Giovanelli and colleagues in 2024. It examined the effectiveness of management training programs for healthcare professionals, particularly those in middle management positions. Leadership in healthcare is crucial because managers influence both staff motivation and patient outcomes. The authors point out that while many hospitals offer training, the actual effectiveness and influencing factor are not always well evaluated. Let's move to methodology. The study was systematic review and meta-analysis of 37 studies conducted across different healthcare systems. Participants include both physician and non-physician who held management roles. The outcome measured were leadership skills, job satisfaction, and organizational performance indicators such as efficiency and teamwork. Discussion and conclusion. The findings showed that management training programs significantly improve leadership competencies and enhance teamwork across organizations. They also increase job satisfaction among staff. Interestingly, the programs had stronger effect for non-physicians compared to physicians, which suggests that training should be tolerated to different professional groups. The authors conclude that leadership training is a valuable investment but must be context specific. The first HR tool is a training needs assessment form. A TNA is a structured framework that allows managers and employees to sit together and identify current skills, compare them with the skills required, and then map the gap that needs to filled. Unlike informal observations, the TNA provides a standardized evidence-based way to decide where to invest in training. Another important point is that TNA forms are not just simple checklists, they are create accountability by linking staff skills gaps directly to organizational performance. For example, if nurse lack training in electronic health records, this can lead to delays in patient documentation, reduced efficiency, and even error in patient safety reporting. By capturing these gaps formally in TNA, HR leads can prioritize high impact areas that improve both staff capability and healthcare outcomes. To illustrate, let me share two examples. The first is for radiographer. The current skill may be basic X-ray positioning, while the required skill is a digital radiography. This creates a gap that requires training in DR system. Because this gap is a considered high priority, the recommended training methods will be combination of hands-on workshops supported by e-learning modules. This ensures that radiographers not only understand the theory but also practice on equipment safety and effectively. The second example is for a nurse. Nurses may already be confident with basic documentation skills, but the required competency today is proficiency in electronic health records. Without this, documentation can be incomplete or delayed, leading to risk in continuity of care. The TNA identified this as a high priority gap and recommended training through workshops, e-learning, and even simulation-based training session. This blended approach ensures that nurses are comfortable with both the technical system and the workflow integration. What makes TNA especially valuable is that dynamic tool. It is not conducted once and forgetting. It can be repeated annually or after major system upgrades to monitor whether training has closed the identified gaps. In this way, the TNA aligned training investment with strategic organizational goals, accreditation requirements such as JCI or DHA, and ongoing improvement in patient safety and quality of care. Ultimately, the TNA forms ensure that training decisions are not random but are data driven, transparent, and tied to measurable performance outcomes. It transforms training from being a cost center into strategic investment in healthcare workforce. The second HR tool is a job description for an HR manager in healthcare organization. The purpose of this rule is not only to design and lead training strategies, but also to ensure compliance with healthcare regulation and to align staff development with the overall vision and goals of the organization. A strong job description brings clarity and transparency to both employees and management. It clearly defines expectations, responsibilities, and measurable outcomes so that everyone understands what success in the role looks like in healthcare. This is particularly important because HR decisions directly impact patient safety, quality of care, and staff satisfaction. The HR manager's duties include conducting training needs assessments, designing training curricula, managing the learning management system, and tracking key performance indicators related to training effectiveness. But beyond that, the rule also involves ensuring compliance with accreditation standards such as JCI and DHA. For example, staff orientation programs must meet specific regulatory requirements, and continuous education must be documented for audits. Another important responsibility is to link training with organizational performance. If turnover rates are high or if employee surveys show low job satisfaction, the HR manager must adapt training programs to address these issues. Similarly, monitoring KPIs such as training completion rates, staff competency assessment, and post training evaluation help HR provide evidence that training investments are actually improving outcomes. In addition, HR manager act as a bridge between management and frontline staff. By listening to the employee feedback, they can design training programs that are particular and relevant instead of purely theoretical. For example, nurse may request a refresher session on electronic health records, while radiographer may need specialized workshop on new imaging system. The HR manager ensures these needs are captured and translated into real training opportunities. Ultimately, the job description of HR manager reflects the dual responsibility of supporting employees while also safeguarding patient care standards. It demonstrates how HR is no longer just about administration. It is about driving performance, accountability, and continuous improvement in healthcare organizations. In conclusion, the two articles show that training in healthcare is a multidimensional digital e-learning supports continuous skill development. while management training builds leadership and teamwork. The HR tools I presented, training needs assessment and job description, demonstrate how we can put these insights into practice. Continuous training and timely leads to better patient care and stronger organization. Thank you for listening.